I'm Dr. Tara from Centra Family Chiropractic. And as a mom, there's a lot of pressure to do everything perfect, and that includes breastfeeding. And if you're having difficulty breastfeeding your child, you feel like a failure, but a lot of times it's not your fault. And so one of the biggest things that we find is if there's difficulty where your child isn't able to feed on one side versus the other, this is due to them physically not being able to actually turn their head. And this is due to the birth process. So a lot of times people don't know this, but during the birth, there can be 40 to 90 pounds of traction on their spine. And because of that, that causes irritation up here, a lot of spasming in the muscles, and the child physically can't turn their head, or if they can turn, it's just painful. And because of that, they'll feed on one side, but then they won't feed on the other side. And so with our child, with Isabella, when she was born, she had difficulty feeding on one side versus the other. And with adjustments, we were able to just calm, relax everything, and make it where she's able to feed and was comfortable. The other thing that we find with kids is if they have difficulty latching, we can actually work on their jaw. And so if they're not able to actually open fully, we can work on this, release the tension, and adjust it. We also do some stuff with the hard palate. So in their mouth, if that's asymmetrical, that can cause some difficulties with latching as well. And then tongue ties as well. So we'll actually go in and work on all the stuff in here and release that and doing some trigger points on the muscle. And all of that will actually help the child get a better latch. So if you're a mom and these are difficulties for you and your child, we'd love to help.